organ is quite unique in the sense that it is an endocrine organ. An endocrine organ means it also secretes hormones. So when it secretes hormones, it's what called thyroxine. So when the hormone is too high or too low, it can cause health problems. Or it can also have structural problems, meaning the thyroid itself can form nodules. So a healthy thyroid means that the hormones are normal and there's no nodules in the thyroid. In order to keep our thyroid healthy, we need to have a healthy body. So that will include having a healthy lifestyle in regards of diet and also exercise as well. But in regards to the thyroid organ itself, the main thing that we need is actually iodine. Iodine is found mainly in seafood and seaweed. So we need to have adequate amounts of iodine to keep our thyroid healthy. In Singapore, most people take enough seafood products, so there's no need for supplements unless you are a strict vegetarian. Number one, for thyroid dysfunction, that means abnormal levels of thyroid hormones, is more common in ladies because most of the time it's caused by autoimmune causes. So autoimmune causes are more common in women. So commonly is what we know as Graves' disease or Hashimoto's. This can cause the thyroid hormone to be very high, or what we call hyperthyroidism, or the hormones will be very low, or hypothyroidism. So symptoms of hyperthyroidism, which is excessive thyroid hormones, will include like anxiety, you feel your heart beating very fast, like palpitations, excessive loss of weight despite eating a lot, or menstrual irregularities. So the opposite happens when you have too little thyroid hormones, or hypothyroidism. So you can start to gain weight, you feel very tired, you have cold intolerance. So when everybody is feeling okay, you feel very cold for no reason, and also have menstrual irregularities. So if you have any of these symptoms, you should go see a doctor, have a blood test done. So as we mentioned above, thyroid hormones affect the whole body. It's found in all everybody, male, female, even in babies and elderly. So it's important to monitor your thyroid function if you notice any change in your basal metabolism. That's number one. So number two, the other causes of thyroid problems is what we call thyroid nodules. So little growths in the thyroid. These are also very common, a lot more common in women than men. So the way sometimes we can notice that there's a swelling in the neck, in the front part of the neck. If it's very big, it may cause compressive symptoms like swallowing problems, or you might feel pressure when you lie down, like something pressing in your neck. And if it's very, very big, it may even cause your voice problems because it can affect the nerves supplying your voice box. So this is what we call a structural problem in the thyroid gland. So if there's many, many nodules, we call it multinodular goiter. Goiter means enlargement of the thyroid gland itself. But don't worry, most nodules are benign, that means not cancerous. Only about 5% of nodules are cancerous. So it's important to have it checked out by your doctor to find out what kind of nodules they are and whether there's anything needs to be done. As a thyroid surgeon, I see a lot of patients with thyroid problem, also of course predominantly women. Most of them present with abnormal screening ultrasound. So as part of the health screening package, many of them have ultrasound done and do pick up some nodules and some cysts. Most of them are not cancerous. So firstly, we need to ascertain whether they are worrisome, what the features that make it look like cancer. So we can do things like a biopsy, which is a very small needle test to check whether it's cancerous or not. If it's not cancerous, we can usually leave it alone unless it's very big or the patient doesn't like it. So traditionally, the way to remove a thyroid nodule is removing part of the thyroid gland, either half the thyroid or the whole thyroid itself. And usually we end up with an incision, that means a scar in the base of the neck. But don't worry too much because usually it fades quite nicely and you can't really see it after a year. Of course, in recent years, we have found other ways to remove it, what we call endoscopic or remote access surgery. We can either go through the armpit or go through the anterior part of the mouth to reach the thyroid to remove it. But these are for very small thyroids. So speak to your surgeon for whether it's suitable for yourself. Other newer ways of reducing the size of the nodule would be what we call minimally invasive methods. The latest one that is in trend now is what we call radio frequency ablation, or RFA, or thyroid nodules. So where a needle is inserted into the nodule under ultrasound to burn off the nodule itself. So this is only suitable for nodules which are not cancerous and about 2 to 3 centimeters. It doesn't remove the nodule, but it makes it smaller by about 50%. So it's mainly for aesthetic purposes. Bearing in mind, all these new advances also has its risks. Even though it's minimally invasive, it also has risks of injury to the surrounding structures. So it's important to discuss with your doctor which is more suitable for you. So in conclusion, most people with thyroid problems are not serious and are not cancerous. So don't worry too much if you receive abnormal screening results. Just go see a doctor, put your mind at ease.